Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Vitamin B deficiency. If there is vitamin B1 deficiency, that is thiamine deficiency, is seen in beriberi. Dry beriberi causes peripheral neuropathy, whereas wet beriberi causes congestive heart failure. Infantile beriberi is seen in cardiomegaly, cyanosis, and dyspnea. Vitamin B2 or riboflavin deficiency. Vitamin B2 or riboflavin deficiency is seen in angular stomatitis, glossitis, and chelosis. Vitamin B3 or niacin deficiency is seen in pellagra. So, in pellagra, we have diarrhea, dermatitis, and dementia. Dermatitis shows Castle's necklace. So this is vitamin B3 or niacin deficiency. Vitamin B6 or pyridoxine deficiency will show refractory seizures in the newborn. So it shows refractory seizures in the newborn is also seen in pyridoxine dependency. Vitamin B12 deficiency. If there is vitamin B12 or cobalamin deficiency, the symptoms are there will be neuropathic symptoms or progressive demyelination is seen in vitamin B12 or cobalamin deficiency. Vitamin K deficiency. In vitamin K is necessary for synthesis and activation of clotting factors 2, 7, 9, and 10. Deficiency of vitamin K is seen in breastfed infants.
thank you and thank you for watching.